All right, today we are going to tackle a really common and, let's be honest, super frustrating problem, trigger finger. We're going to look at its most popular treatment, those corticosteroid injections, to figure out if they're actually the quick fix they're cracked up to be. Let's jump right in. You ever have that weird, sometimes kind of painful feeling? You go to bend or straighten your finger and it just stops. It gets stuck. Maybe it clicks or pops or just locks up completely. If any of that sounds familiar, you've probably had a run-in with trigger finger. It's surprisingly common and can be a real pain in the neck. Well, in the hand. So what is actually going on in there? The fancy medical term is stenosing flexor tenosynovitis, which is a mouthful, right? So let's make it way simpler. Think of a frayed rope trying to get through a tiny little ring. That's basically trigger finger. Your flexor tendon is the rope, and when it gets inflamed and swollen, it struggles to glide through the A1 pulley, which is that ring at the base of your finger. All that friction is what causes that awful catching and locking sensation. Okay, so you go to the doctor with this problem. One of the very first things they're probably going to suggest is a corticosteroid injection. It's pretty much the go-to first-line treatment if you want to stay out of the operating room. But why this treatment specifically? Well, the logic behind it is pretty straightforward. Corticosteroids are amazing anti-inflammatories. The whole point of the injection is to get that powerful medicine right to the source of the problem. The idea is to shrink the swelling around the tendon, or rope, so it can slide smoothly through the ring again. Problem solved, right? Or is it? And that right there brings us to the big question. I mean, the theory sounds great, but what does the actual evidence say? Do these injections really work? Let's dig into the data and see what's what. So here's the headline number for you. Studies show that a single steroid injection has a success rate somewhere between 45% and 80%. Whoa, that is a massive range, right? And it tells us something really important right off the bat. It works for a lot of people, but it is absolutely not a guaranteed cure. And get this, it's not even the same for every finger. One study found that trigger thumbs respond incredibly well. We're talking a 92% success rate. But that effectiveness takes a nosedive when you look at the ring and little fingers. Now, whether an injection works or not isn't just random luck. Researchers have actually pinpointed a few key things that predict failure. For instance, if you've got multiple trigger fingers at once, if your symptoms are really severe and have been going on for more than 3 months, or if you have metabolic syndrome, your odds of that first shot working are unfortunately quite a bit lower. Okay, let's bust a myth right now. For a long time, the common wisdom was that having diabetes meant steroid injections just wouldn't work as well for you. Well, it turns out that's probably wrong. Newer, much larger studies have totally flipped that idea on its head. They found no significant difference in success rates at all. That's a huge shift in how we think about this. Dosage matters too, especially in the short term. You can see a really clear dose-dependent effect here. At the 6-month mark, a higher 20 milligram dose has a 79% success rate, which is way better than what you get with the lower doses. But, and this is a big but, here's the catch. That short-term advantage totally vanishes over time. By the time you get to 1 year, the success rates for all the different doses pretty much level out. So a bigger dose might get you relief faster, but it doesn't mean that relief is going to last any longer. So what happens if that first shot doesn't do the trick? Is it just game over? Not at all. Research shows that trying again can still work. About 39% of people who get a second or even a third injection end up getting long-term relief. It gives them another real shot at avoiding surgery. But of course, injections aren't the only non-surgical game in town. So how do they really stack up against other options? Things like NSAIDs, physical therapy, or even just wearing a splint. So let's put it head-to-head with an NSAID injection. In the short term, the steroid shot is the clear winner, no contest. It resolves symptoms in 70% of cases after just 3 months. But if you fast forward to 24 weeks, their results are almost identical. So you're basically trading immediate relief for the same long-term outcome. And what about physiotherapy? Well, it's a similar story. Injections give you better pain relief and get you back to normal function faster. But here's the trade-off. Studies show that if you get the injection, you have a higher chance of the pain coming back later compared to the folks who stick with physiotherapy. Interesting, right? Now this one might be the biggest surprise of all. When you compare a steroid injection to something as simple as just wearing a splint, after 1 year, there's no real, meaningful difference in pain or function. This suggests that for some people, the much less invasive option of splinting could be a totally reasonable first choice. Okay, so we've looked at all these conservative options. But what happens when they just don't cut it? Well, it's time for the final showdown. The quick, non-invasive injection versus the definitive cure, surgery. And this is the most logical question in the world, right? If surgery is the ultimate fix, why would anyone bother with injections that might not even work? Why not just cut to the chase and get it over with? Well, the answer is all about that classic trade-off, risk versus reward. First, let's set our baseline. A major study found that the cure rate for a corticosteroid injection when you check back in after a year is about 49%. So basically, a coin flip on whether it gives you a lasting solution. And now, surgery. At that same 1-year mark, the cure rate for a surgical release is an absolutely staggering 99%. I mean, for all practical purposes, it is a definitive cure. The contrast could not be more dramatic. But, and this is a huge but, a 99% cure rate doesn't come for free. While surgery is incredibly effective, it comes with small but serious risks, things like infection or even nerve injury. Injections, on the other hand, have that much lower success rate, but their potential side effects are way less severe. Maybe a temporary flare-up of pain or some minor tissue changes. It is the classic risk versus reward dilemma. So let's wrap all this up. What are the key takeaways here? First, steroid injections do work for many people, about half long-term, but they are not a magic bullet. Second, success isn't just a lottery. It depends on real things, like which finger it is and how bad your symptoms are. Third, don't sleep on the alternatives. Splinting could be just as good in the long run. And finally, surgery is as close to a guarantee as you can get, but you have to weigh that against its higher stakes. And I want to leave you with this powerful quote. This is directly from the research. Even if that first shot is a bust, about half of the patients who get repeat injections get a full year or more of relief. This really makes them a valuable tool for pushing back or maybe even completely avoiding that trip to the operating room. And that brings us to the final question. And it's a personal one. There's no single right answer for everybody. When you're faced with the near certainty of surgery on one hand and the safety of a less certain injection on the other, what matters most to you? That's the core of the conversation you need to have with your doctor to figure out the best path forward for you. Thanks for joining me for this explainer.